Join us at Health Talk Desk. Make sure to subscribe, like and share our videos to keep spreading vital thyroid health insights.
For the last couple of weeks, we've had people giving stories on their thyroid stories, how they went through hyperthyroidism, hypothyroidism, and many other thyroid-related diseases. So today we have a special topic, and we want to educate you so that you can have a deeper understanding of your thyroid gland. So my name is Alan, and I want to welcome you to the YouTube channel today. The name is Health Talk Desk. So please go subscribe, like, and share to your friend so that you can learn together. So we want to understand more about thyroid and what is thyroid. So thyroid is a butterfly-shaped gland, and it's located on your neck below the trachea. Not below, above the trachea. So thyroid has two sides. It's on the left side, which is called the left lobe, and the right side, which is called the right lobe. So like I said, it's a small butterfly-shaped gland located at the front of your neck under your skin. It forms an integral part of your endocrine system. So we'll later look at what is endocrine system. But before, let's first understand what thyroid is. It controls your body important functions by producing and releasing body hormones. So we'll also look at what hormones does your thyroid produce. So your thyroid main job is to control the speed of your metabolism. So what is metabolism? Metabolism is a process of how your body transforms the food that you eat into energy. It's called metabolism. So that's the main function of your thyroid. And on top of that, like we said, it produces and controls body hormones. So all these cells that in your body needs energy to function. A human being has many millions of body cells. And for your body to function, they need energy. They get this energy from the food that you eat. So your thyroid, again, now becomes a very important character or a very important part of your body system. So when your thyroid is not working properly, it can impact your entire body system. Hapo ndio tuko. So previously, tumesikiza story za watu, people narrating what they went through with the thyroid diseases. Some lost eyes, some lost families, some lost friends. And today, now we want to understand what is this thyroid? So that whenever you walk, whenever you feel funny, or whenever you suspect that your thyroid has a problem, then you're able to discover very early and go and get checked. So before, hapo juu, we mentioned about endocrine system. So what is an endocrine system? So an endocrine system is a network of several glands that creates and secretes body hormones. Example of these organs and glands, one is hypothalamus, pituitary gland, thyroid itself, parathyroid glands, adrenal glands, pineal glands, pancreas, ovaries, and testes. Those are 9 examples of endocrine system glands. So what is the function of your thyroid? As an endocrine gland, your thyroid makes and secretes hormones. That's what we said. Kazi yake ni kutengeneza na kurelease body hormones. Now, remember, I mentioned thyroid as part of the endocrine system. I also mentioned pituitary gland. Thyroid and pituitary gland, they communicate. Pituitary gland is in your brain. Thyroid is on your neck. But there's also another very important gland that is called pancreas. I'm sure you know someone who has died because of pancreas-related diseases, thyroid-related diseases, pituitary gland-related diseases, and so many other glands that I've mentioned. All these, the main focus or the main couplet of all these diseases that affect these glands or organs is thyroid. And that's why we are here today. We want to have a deeper understanding of this thyroid gland. But before we proceed from there, I would request two things. Number one, please, if you're watching, you've not subscribed, remember to subscribe. Why? Because we want you to get up-to-date videos about your thyroid health. After you subscribe, please share with a friend so that they can also get to learn. Thank you for doing this. Now, your thyroid produces and releases the following body hormones. Number one is T4. If you're watching me, if you're watching this video, and you have had a thyroid-related diseases, you understand what I mean by T4. You've had your doctor mention about your levels of your T4, levels of your T3, and levels of your TSH. So you're going to discuss these three hormones, or rather four hormones, in a deeper way, so that we can deeply understand what T4, what T3, what TSH is, and what is any other hormone that is related to your thyroid.
Join us at Health Talk Desk. Make sure to subscribe, like and share our videos to keep spreading vital thyroid health insights.
So what is T4? So T4 is the primary hormone that your thyroid makes and releases. It is the primary hormone. I'll repeat. Primary hormone. Underline the word primary, because I want us to understand this thyroid better. Although your thyroid makes the most of this hormone, it does not have much of an effect on your metabolism. Okay? Once your thyroid releases T4 into your blood stream, it can convert to T3 through a process that is called deiodination. Deiodination, from the word iodine. Deiodination. So deiodination is the process where T4 is converted into T3 by your thyroid. So what does that tell you? That your thyroid to perform properly, you need iodine, which we get from the salt that we eat. We'll look into that.
Join us at Health Talk Desk. Make sure to subscribe, like and share our videos to keep spreading vital thyroid health insights.
So the second hormone that is produced by your thyroid gland is called T3, or 𝗙𝗪𝗻. 𝗙𝗪𝗻. In short form is T3. So your thyroid produces lesser amount of T3 than T4. But this T3 has much greater effect on your metabolism than T4. So your metabolism is run by the T3 than the T4. That means it's one of the responsible, it is one that is responsible for your body food absorption, the process that is called metabolism. The third hormone that is produced by your thyroid is RT3. RT3, or reverse 𝗙𝗪𝗻𝘆. Reverse 𝗙𝗪𝗻𝘆. So your thyroid makes this very small amount of RT3, which reverses the effect of T3. And finally, the last hormone that is produced by your thyroid is called calcitonin. Calcitonin. Calcium. Calcitonin. This hormone helps regulate the amount of calcium in your blood. So if you ever go to the hospital and your doctor tells you that your calcium levels are either low or they are high, the first culprit to suspect is your thyroid. Most likely, very high chance that your thyroid is not producing enough calcitonin. So ask your doctor to check your thyroid. Now, in order your thyroid to make thyroid hormones, you need iodine, enough iodine. The word is enough, not much, not less, enough. Now, iodine, you get it in the food that we eat, or most commonly known as iodized table salt. Iodinized table salt. Iodinized table salt is the salt that we usually eat in our food. So whenever you eat your food, make sure it has enough salt, not much, not less. Unless your doctor has advised you not to take salt. If you're not advised not to take salt, then you need salt in your food because your thyroid needs this salt. So the second source of iodine, where you can get iodine, is the water that we drink. So that's why your doctor keeps telling you to take enough water. So what your thyroid does, it traps this iodine and transform it into thyroid hormones. So if you have too little or too much iodine in your body, it can affect the level of hormones your thyroid makes or releases. So your thyroid hormones affect the following body functions. Now, number one is your heart rate. So excess thyroid hormones will increase the force of contraction of your heart muscle, and then in returns, that will increase the amount of oxygen demanded by the heart. And automatically, the heart rate will increase. So you're seated and your heart is pumping very fast. The first culprit to suspect is your thyroid. So as a result of this, the work of your heart is gradually increased and your heart is on overdrive, okay? And with the for example, with the hypothyroidism or hyperthyroidism may present this kind of symptoms, most likely. So if your heart is racing very fast with no unexplainable reason, haujakimbia, haujafanya anything that will make you feel tired, and all of a sudden your heart starts racing, the first thing to suspect is your thyroid. Now, if you have cardiac arrest symptoms that cannot be explained, if you have cardiac symptoms that you cannot explain, the first culprit to suspect is your thyroid. Go have your thyroid checked. The sooner you do that, the better. Because many people have died. We have heard stories. You know someone, or you know someone who knows someone who has died because of cardiac arrest. No one tells you what caused the cardiac arrest. The suspect number one is your thyroid. So thyroid has killed many people, and it presents, thyroid disease has killed so many people, and it will always present itself like so many other diseases that are very common, okay? The second function that is affected by your thyroid is your breathing system. So like I said, both hypothyroidism and hyperthyroidism cause respiratory muscles weakness and decrease your pulmonary function. Now, hyperthyroidism reduces respiratory drive and can cause obstructive sleep apnea, or it's called pleural effusion. Pleural effusion. I said I may not be very good in these terms, but just make sure you get the message. And for hyperthyroidism, that is hypo. And for hyperthyroidism, it will increase your respiratory drive and can cause dyspnea or exerton. It's called dyspnea or exerton. And compression of trachea, which may be positional or can occur with nodule goiter, which in turn can cause thyroid cancer. And the latter can spread to the lungs. So if you have thyroid cancer, you have a very high risk of lungs cancer. This is caused by the breathing problem that is caused by your thyroid. So if you have lungs cancer or thyroid cancer, and you have a problem in breathing, culprit number one to suspect is your thyroid. So thyroid is the one that is messing all that. And this is why we need to have this discussion and this conversation and to understand how important is your thyroid gland. Number three is the digestion. If you remember, in my introduction, I said that your thyroid main purpose is metabolism. Now, listen, when your digestion is not properly working, or when you have digestive symptoms, or when you have an overreactive thyroid, or rather hyperthyroidism, this always include difficulty swallowing, vomiting, diarrhea, lactose intolerance. Ukikunywa chai ya maziwa unaanza kusikia some funny things, unafula tumbo. I mean, you're not comfortable when you take milk, tea with milk. I've had people say, mimi sikunywangi chai ya maziwa. Nikikunywa chai ya maziwa nasikia tumbo inafura. Ama nikikunywa chai ya maziwa nasikia kutapika. Go and have your thyroid checked. It can also have liver problems. H. pylori bacteria. Weight loss. That is for hyperthyroidism. Hypothyroidism or little thyroid hormones in your body can cause body pressure to slow down, or body process to slow down. Hence, you'll find someone gaining a lot of weight that you cannot explain where this weight is coming from. So you're not eating, you're very active, but your weight is being uncontrollable, or you're growing big uncontrollably. So the first thing you suspect is your thyroid. Number 4 is your body temperature. So for hyperthyroidism, this may cause sensitivity to heat and excessive sweating. So if you're seated, you always sweat. When wale watu wasikiangi baridi, you're always on hyped mood. Okay? Then the first thing to suspect is your thyroid. You may be suffering from something that is called hyperthyroidism. Whereas the opposite, which is hypo, you may struggle to keep yourself warm. Okay? Every time you feel cold, even when there is no cold, you're feeling cold. Okay? That means there is something wrong. So the first culprit to suspect, again here, is your thyroid. So when the body thyroid is not working properly, its cells can reduce 65% energy, and that they can produce 65% energy and that 5% heat. So number 5 is your brain development. How your brain develop. So thyroid hormone are crucial for brain development and may influence brain function throughout your life. Wala watu wa kusahau. You easily forget, and then you start saying you're growing old. In fact, if you're growing old and naturally you're supposed to start forgetting, I think at 80. And sometimes it's not obvious. So if you're still young and you keep forgetting, the first thing to suspect, or culprit to suspect, is your thyroid. Now, in adults, hyperthyroidism causes something we call lethargy. It also causes something we call hypoparathyroidism. 𝗪𝗵𝘃 and poor motor coordination, and is associated with your bipolar, affective disorders, depression, or loss of cognitive functions. So watu wote wako na bipolar issues, disorders za depression, loss of cognitive function, you cannot recognize people, you cannot recognize things, go have your thyroid checked. Number 6 is your mental activity. This is more related to what you've just discussed about your brain development. So because your brain is not properly developing, then you also start having problems with mental activity.
Join us at Health Talk Desk. Make sure to subscribe, like and share our videos to keep spreading vital thyroid health insights.
Number 7 is skin and bone maintenance. So if your thyroid hormones levels stay too high or too low, you are more likely to develop low bone density. Okay, this is particularly likely if you are a post-menopause woman. So if you have that age that you're past menopause and you have a problem with thyroid, it may develop into other things. And finally is fertility. Your thyroid greatly, very high chances will affect your fertility. So low levels of thyroid hormones can interfere with the release of an egg from the ovary, or what we call ovulation, which impairs infertility. This is on women. Now on men, it can also affect your fertility, and your sperm production becomes a problem, and therefore you're not able to produce enough sperm count to make a woman pregnant.
Join us at Health Talk Desk. Make sure to subscribe, like and share our videos to keep spreading vital thyroid health insights.
So, like I said previously, as I was doing the introduction part, I mentioned of an endocrine system, which is a system that has so many organs under the whole system. And some of these organs or glands work closely with our thyroid gland. So your endocrine system is an elaborate network of glands and hormones. And many glands and hormones rely on each other to send them signals to start working. And in addition, certain hormones can suppress other hormones. So one hormone can produce hormone A, another one produces hormone X, then hormone X suppresses hormone A, becomes a problem. So it must be a balanced equation. So your thyroid and your endocrine system must work in a balanced way. If one of these is not properly working, then you develop a condition. So your body has a complex system for controlling the level of thyroid hormones in your body or in your system. First, for example, is your hypothalamus, which is part of the brain, and it works closely with your thyroid. And the work of the hypothalamus is to release a thyroid hormone, what we call thyroid releasing hormones, TRH, which stimulates part of your pituitary glands. So hypothalamus and pituitary gland, they work together to send signals to your thyroid. Okay, so which stimulates. So now the TRH stimulates part of your pituitary gland to secrete now the thyroid stimulating hormones, which is TSH. The other one was TRH. So your hypothalamus releases TRH, which stimulates the pituitary gland to produce TSH. Then TSH stimulates your thyroid cells to release T4. or what we called thyroxine. Umeelewa hapo? Ama mumepotea? And then the T3. So without the TSH, you cannot produce, no, without the TRH, you cannot produce the TSH, and you cannot produce the T3 and the T4. So the hypothalamus produces TRH, which stimulates the pituitary gland to produce TSH, which now again stimulates your thyroid to produce T3 and T4. I hope that is clear. So if there are adequate levels of iodine in your body, that is when that happens. If there is not enough iodine in your body, that will not happen. And then you'll develop either hypo or hyper. Now, your thyroid gland and its hormone affect most organ system in your body. Most. Number one is your cardiovascular system. Or your heart. Let me use simpler language. Your heart. So you remember we also spoke about the breathing, the heart palpitations, or that is affected by your thyroid. Now, we've also said that these hormones, the hormones that are produced by your thyroid, affect most parts or most organs that your system has. And for example, is your heart. So therefore, your thyroid helps regulate the amount of blood your heart pumps. Okay? Through your circulatory system or cardiac output. And therefore, your heart and the strength of your heart contractions is determined by your thyroid. Now, number two is your nervous system. When your thyroid is not working properly, it can cause symptoms that can affect your nervous system, including numbness. You feel numbness at the end of your fingers, tightening, pain, or sense of burning in the affected parts of your body. Okay? You can also feel, for example, for people with hypothyroidism, it can cause depression. And for hyperthyroidism, it can cause anxiety. So some of the depression cases that we are dealing with, they are caused by the thyroid.
Join us at Health Talk Desk. Make sure to subscribe, like and share our videos to keep spreading vital thyroid health insights.
So some of the depressions that you're dealing with, depression cases that you're dealing with, they are caused by the thyroid. So it is very important, even when you go to the hospital, just on a random case, ask your doctor to check your thyroid. And most people who suffer from thyroid-related diseases, they will tell you that they have gone to hospitals for years, for a very long time, without doctors being able to point out exactly what is ailing them. Now, the other thing that your thyroid hormone will affect is your digestion system. Your thyroid is involved in how food moves through your body system. So if it has a problem, then your gastrointestinal mobility becomes a problem. You find you start bloating of stomach. You go to hospital, unaambiwa you have H. pylori, because some of these symptoms, or some of the symptoms that comes along with thyroid-related diseases, mimic so many other symptoms of very common diseases. So even doctors themselves, they are not able to pick the exact problem, and they will start treating you of so many other diseases. Now, the other thing that your the hormones that your thyroid produces can affect is your reproductive system. So if your thyroid is not working properly, again, it can cause regular menstrual periods and issues with fertility. So if you're sitting there and you're watching this video and you are a girl, or you are a lady, or you are a woman, whichever you want to call yourself, and you have irregular menstrual cycles, inakuja tarehe 7, the next month inakuja tarehe, you can barely say this is my period of menses. They come when they want and they disappear when they want. And then when you go to the hospital, the doctor will give you pills to stop your menses. So when the doctor stops your menses, because your body is still releasing the eggs, what happens? You cause more problems into your body system. So if you have irregular menses that you cannot explain, and your doctor goes and tells you, stop using these family planning pills, stop doing this, take a lot of water, let's give you these pills so that you stop the menses, tell the doctor to check your thyroid gland. And most cases, you'll find that your thyroid gland has a problem, which is causing this. Now, I know I've said so many things. Some I know you can't remember, but I ask you to keep watching this video. Make sure you subscribe, share. So we're going to take a short break as we digest what you've just talked about. And when we come back, we'll see how you can live without a thyroid. Because many people are asking, can someone live without a thyroid? If it's causing these problems, can someone live without a thyroid? If it is sick, can it be removed and live without? So we'll see that after we come back. Thank you very much for watching.
Join us at Health Talk Desk. Make sure to subscribe, like and share our videos to keep spreading vital thyroid health insights.
Now, karibuni tena to the second part of our interactive session or educative session, because here I said we are educating each other about your thyroid. If you have any question or any comment, please, hapo chini kuna mahali kumeandikwa comment. Drop a comment, drop a question, and we will get a medic who knows about more of your thyroid, because I'm not a medic. I'm just, I have learned through thyroid, I've learned thyroid through experience. So if you have a question or anything that you'd want to ask about your thyroid, please send us an email at healthtalkdesk@gmail.com or leave a comment on the comment section and your phone number or your email address, and we'll get back to you. Now, let's look at a very common question that people ask. Can someone live without a thyroid gland? The answer is yes. You can live without a thyroid gland. But you'll have to be on medication, because it will cause a condition that is called hypothyroidism. Hypothyroidism is when your thyroid is producing less hormones. Now, because you don't have a thyroid, which means your body is not producing enough hormones, so you develop a condition that is called hypothyroidism. Now, you can live without your thyroid, but I said you need to take hormone replacement medicine for the rest of your life, because you don't have the thyroid that is supposed to do some functions. Now, for your body to function properly, then you have to be on medication. Now, a thyroid removal surgery, or better still known as thyroidectomy, is a common surgery that you can do when your thyroid has a problem and you are not able to treat it through medicine. Now, these are some common methods like that you can use to treat your thyroid. Number one, you can use medicine. It's called anti-thyroid medicines like 𝗪𝗵𝘆𝗶. Those who have thyroid diseases. I'm sure you've had or interacted with 𝗪𝗵𝘆𝗶. Or you can also do radioiodine therapy, which is not a very recommended. It's not recommended, or it's not a better way to treat your thyroid. Now, what conditions and disorders affect the thyroid? So thyroid yako inaweza kuwa mgonjwa. What are these diseases that we are talking about? Because thyroid is a gland, and most people, when they are talking about thyroid diseases, wanasema niko na thyroid. You know, everyone has a thyroid gland. So it is not a crime or it is not a sickness to have a thyroid gland because everyone has. But the question is your thyroid gland operating well, or is your thyroid gland healthy? Now, there are several different types of thyroid diseases, and thyroid diseases are very common, but little known. Not many people who know about this disease, and it's very common. And therefore, it's killing a lot of people because people are not able to identify it early enough. And with the majority of these people being women. Okay? We are out of about 5 out of 8 people. 5 out of 8 people, 5 who have thyroid problems are mostly women. And the rest are men. So it's not very common in men, but it is there in men like myself. And I know quite a number of men who are suffering with thyroid diseases. Now, the problem is when men know that they have a thyroid problem, because of the stigma that is associated with this disease, because it's mainly known for women, they don't want to come out and speak. And therefore, I'm asking, if you're there, you're a man, you're watching this video, and you are struggling with a thyroid disease, speak about it, educate someone, tell people that yes, even as men, we get affected by thyroid diseases. Now, thyroid diseases are split into 2 types. There is primary and secondary. Primary disease and secondary disease. And in primary disease, the disease originates in your thyroid gland. The primary thyroid disease, it originates from your thyroid itself. Where the secondary thyroid disease or diseases originates in your pituitary gland. So your pituitary gland can cause a thyroid problem, and your thyroid can cause a thyroid problem. For example, if you have a nodule on your thyroid or on your thyroid or neck, something is swollen, some inflammation on your neck, that is releasing excess hormones or thyroid hormones. It could be called, that could be a primary hyperthyroidism, because the problem has come from your thyroid itself. So it becomes a primary hyperthyroidism. Now, if you have a tumor in your pituitary gland or underneath your brain, you have a tumor which is releasing excess amount of thyroid stimulating hormones or TSH, which then stimulates your thyroid to produce excess thyroid hormones, that could be a secondary hyperthyroidism. So if you have a secondary, you go to the hospital and you have hyperthyroidism, it's not necessarily that it's coming from your thyroid. It could be coming from your pituitary. You could be having a tumor on your thyroid gland, on your pituitary gland, which is causing your pituitary gland to produce excess TSH, which now then stimulates your thyroid to produce excess T3 and T4. Now, so you must understand, before you start treating, you must understand what are you treating. Are you treating a secondary hyperthyroidism or a primary hyperthyroidism? Now, the 4 main conditions that can affect your thyroid are: number 1, hyperthyroidism. This is an underactive thyroid, so which means your thyroid is not producing enough thyroid. Number 2 is hyper. There is hypo and there is hyper. Number 1 is hypo. Number 2 is hyper, overreactive thyroid. So your thyroid is producing more hormones. Number 3 is goiter, the enlarged thyroid. So when you hear people speak about goiter, someone says, I have goiter, niko na goiter kwa shingo. Wengi wenu mnaambianga wa mkule chumvi ama msikule chumvi. That's not the case. The problem is, actually, it's your thyroid that is swollen. So a swollen thyroid is called goiter. Number 4 is thyroid cancer. Now, as a result of the enlarged goiter, reduces exposure or diet low in iodine and faulty genes. This may cause thyroid cancer. So if your goiter is swollen, or if your thyroid is swollen, do not ignore, because if you ignore, it will develop to be something else. So most likely, untreated goiter becomes thyroid cancer. So if your goiter is swollen for a very long time, do not ignore. Go get checked. Make sure that you're checked off thyroid cancer and your goiter is treated. And the only way you can treat your goiter is to remove your thyroid, because goiter is a swollen thyroid. Now, let's discuss these four in details so that we can understand what is hyperthyroidism, how is it treated, what is hypothyroidism, how is it treated, what is goiter, how is it treated, what is thyroid cancer, what causes it, and how you can treat it. So hyperthyroidism or underreactive thyroid happens when your thyroid doesn't produce and release enough thyroid hormones. So when your thyroid is producing less hormones, you're now hypothyroidism. And this mostly will affect your body metabolism or slow down your metabolism. And it will result into so many other things if your metabolism is not is slowed down. And some of the causes of the hypothyroidism includes Hashimoto's diseases, an autoimmune disease, Hashimoto or an autoimmune disease, thyroiditis or inflammation of your thyroid. And this mostly will affect your body metabolism or slow down your metabolism. And it will result into so many other things if your metabolism is not is slowed down.
Join us at Health Talk Desk. Make sure to subscribe, like and share our videos to keep spreading vital thyroid health insights.
Cause number 3 of hypothyroidism is iodine deficiency. So if you don't have enough iodine in your blood or in your system, then you may develop hypothyroidism. Now, another thing that may cause hypothyroidism is an unfunctioning thyroid gland. So when your thyroid is not properly functioning or does not work correctly from birth. So we have people who are born with thyroid disorders. In developed countries, when a child is born, as they check their other vital body organs, they also check their thyroid. But in Kenya, people have ignored it. And it's killing a lot of babies, it's killing a lot of people, and it's making many babies or many young people to develop with other issues that are originally related with thyroid problems. Now, another one is overtreatment of hyperthyroidism. So if you take the hyperthyroidism is the opposite of hypo. So hypo is when your thyroid is not producing enough hormones. Hyper is when it's producing more. So if you overtreat your hyperthyroidism, then again you develop hypo. Then the last one, it can also be caused by removal of your thyroid gland. So if your thyroid gland is misbehaving and you cannot treat it with medicine, and the only option is to remove it, then you develop hypothyroidism. Okay, what are the most common symptoms of this hyperthyroidism? Number 1 is tiredness. If you're always feeling tired, you cannot explain why you're feeling tired, go have your thyroid checked. Number 2 is being sensitive to cold. You're always on sweaters. Hata kukiwa na jua, wewe umevaa fulana. Even when the sun is, you're still on sweater. Go have your thyroid checked. If you're losing or you're gaining weight, you cannot explain why you're gaining a lot of weight, have your thyroid checked. Constipation. Unakula chakula kidogo, tumbo imefura. Sometimes haujakula, tumbo imefura. Another one is depression. You're depressed. Low movement or slow movements and thoughts, you're lazy, you're very lazy, You can't do things, muscle aching and weakness, muscle cramps, dry and scary skin, brittle hair and nails, loss of libido or sex drive. You're not feeling interested anymore, pain, numbness, and tight tingness. We call it tingness or sensation on your hands and fingers. Okay, irregular periods or heavy periods. These are some of the symptoms to suspect that you have a thyroid problem. Now let's look at hypothyroidism, which is the opposite of hyper. So hypothyroidism is an overreacting thyroid. So your thyroid is producing much more hormones than your body needs. Now, what are the main causes of hyperthyroidism? Number one is a grave disease, grave disease. Grave disease is an autoimmune condition of your thyroid. So your thyroid is fighting itself. Number two is thyroid nodules. If you have thyroid nodules, it may result into hyperthyroidism. So your thyroid will start producing more hormones because of the nodules that are on your thyroid. Thyroiditis is also another cause of, remember, this is also another cause for hypo. So it's still another cause for hyper. Postpartum thyroids, or inflammation of the thyroid that happens after giving birth. So there are people who, when they give birth, their thyroid swells. Okay? It develops a thyroid problem that is called hyperthyroidism. So this is called postpartum thyroiditis. Another one is the excess iodine in your blood from the food that you eat. So if you eat a lot of iodine in your food, again, you'll cause your thyroid to have problems. Over treatment of hypothyroidism, if you treat your hypothyroidism condition for a very long time, you become hyper again. Or a tumor in your pituitary gland, again, it can also cause a thyroid problem. So thyroid problems are related to so many other glands or organs in your body. So when you check your thyroid and you find your thyroid has a problem, it is always important to check your pituitary gland because it could be having a tumor. And these tumors can develop into brain cancer. If your thyroid is not treated or it's swollen and it's not treated, it can develop into thyroid cancer, which can go up to your lungs. Now, what are the symptoms of hyperthyroidism? It's the opposite of hypo. Number one is nervousness. Nervousness. You're always nervous. Anxiety. Irritability. You nakasirika. Something small makes you feel, like the whole world is on your shoulders. Hyperreactivity. You may find it's hard to stay still and have a lot of nervous energy. You go to church, you're seated, you can't sit for 5 minutes, you want to wake up, you're in a meeting, after 10 minutes, you're already out of the meeting, you can't sit in one place for more than 10-15 minutes. Mood swing. Right now you're happy, the next minute you're not happy, difficulty in sleeping, feeling tired all the time, sensitivity to heat. Remember the other one was sensitivity to cold. Now it's sensitivity to heat. You're always sweating, even when there is the weather is very cold, you are not on sweater and you're okay, When people are freezing, well, uko sawa, and you start thinking that you're healthy. You're not healthy. Go get checked. Then muscle weaknesses, you feel your muscles are always weak, because you're tired, you're lazy, you feel like you don't want to do anything, and therefore your muscles are very weak. Diarrhea, you always diarrheaing, you've not eaten anything bad, you're taking enough water, but you always have a loose stool. Needing to pee more than usual is also another symptom for hyperthyroidism. Persistence, thirst, always taking water. And then you start thinking that you have blood pressure or sugar things, blood sugar things. It is not always like that. Maybe you have a thyroid problem, you need to get checked. Itchiness, kwa mwili, loss of interest in sex, like it was for hypothyroidism, unexplained weight loss. Yeah, the other one was unexplained weight gain. Now it's weight loss. When you have hyperthyroidism, you lose a lot of weight that you cannot explain. And because your metabolism is now very fast, you find you're eating like 3, 4, 5 times in a day, and you still want to eat, and you can't gain weight. We have thyroid diseases have messed families because a man will be sitting there, and the husband is not interested with sex, and they will think of other things. No, it's not always like that. Please take him to the hospital. Let his or her thyroid get checked, because he or she could be having a problem that you don't know about. The other disease about thyroid-related disease is the goiter. Now, this is caused by lack of iodine in your body, like we said. So your thyroid enlarges to try and capture the iodine that is around it. So that's the reason why your thyroid will swell and you develop something we call goiter. So if you don't have enough iodine in your body, and your thyroid need the iodine to produce hormones, so what does it do? It start looking for the iodine that is around it. So it will swell so that it can get iodine from other places, and in return, or at the end of the day, you'll find your thyroid is swollen and you develop what we call goiter. Now, goiter, they are in several different, they are caused depending on their, goiter have different causes depending on their type. So we have simple goiters, we have endemic goiters, we have sporadic goiters, and all these are goiter. They are goiter diseases. Now, simple goiter, goiters develop when your thyroid gland doesn't make enough hormones. This is what is mostly common for every goiter person you see. Most likely, they are not having enough iodine in their body, and therefore their goiter swells. So your thyroid gland tries to make up for the shortage, and by growing bigger. Now, endemic goiters, these goiters occur in people who doesn't get enough iodine in their diet. So it is necessary to make thyroid hormones. Iodine is added into table salt. So people usually don't get endemic goiters. So endemic goiters is not very common. Why? Because you get endemic goiter when there is no iodine in your body system, is when you get endemic goiters. But it's not very common, and the reason why it's not very common is because we always eat food with salt. Now we have sporadic goiters. So sporadic goiters, they have no known cause in most cases. So in some cases, certain medications such as lithium can cause sporadic goiters, but it's not very known. The cause is not clearly known. Then we have thyroid cancer. So thyroid cancer is cancer that begins in your thyroid tissues. It's called thyroid cancer. So thyroid cancer is the cancer that begins on or from your thyroid tissues. Treatment for these thyroid cancers are very successful. Most of them, 90%, they are successful. And thyroid cancer is classified based on type of cells from which your cancer has grown from. So that's these types. Some of these types of these cancers includes papillary. Papillary is mostly is up to 80% of all the thyroid cancers are caused by papillary. Then we have number 2, follicular. Follicular thyroid cancer accounts for up to around 15% of thyroid cancer cases that we have. Then we also have medullary. It's called medullary. Medullary, 2% is not very common. And we have anaplastic. Anaplastic is also not very common. It's 2% of most of the thyroid cancers that we have. Now, let's look at what are the early warnings or signs or symptoms of thyroid problems. We've discussed them before, so we'll We'll go very quickly into this. So different types, different thyroid conditions have different symptoms. However, since your thyroid has a large role in certain body symptoms and processes, such as heart rate, metabolism, temperature control, we've mentioned them. Most of them we've mentioned. These are certain symptoms to look out for that could be a sign of a thyroid condition. So if you have a problem with some of these things, always suspect your thyroid. So some of these things could be things like slow or rapid heart rate, unexplained weight loss or weight gain, difficulty or tolerating cold or heat, depression or anxiety, irregular menstrual periods. Some of these things are very early signs that you have a thyroid problem. If you're losing weight, you're gaining weight, you've always have anxiety, you're developing depression, you cannot tolerate heat or cold, rapid heart rate, these are very early signs that you have a thyroid problem. So if you are experiencing any of these symptoms, talk to your health care provider about getting your blood tests to check your thyroid function. So what are most common tests to check? How do you check your thyroid problem? Basically, you go to the hospital, you'll get a blood sample, they'll take to the lab, and they'll check your T3, T4, and your TSH. That's how simple it is. So you don't have to do a surgery to check your thyroid, blah, blah, blah. Enda kwa lab, tolewa damu, wapime T4, T3, TSH. When you get your levels, the doctor will tell you your levels are okay or your levels are not okay. Then from there, you can now start the treatment. Now, how are thyroid conditions treated? Very important.
Join us at Health Talk Desk. Make sure to subscribe, like and share our videos to keep spreading vital thyroid health insights.
We've discussed about so many thyroid conditions. Now, it's also important to look at how these conditions are treated. So the next session, we're going to look at how do we treat thyroid conditions. So there are several treatment options for thyroid conditions, depending on what the conditions are and how severe they are. And there are only three options there are three main options for treatment of thyroid conditions. So number one, you can decide to use medicine. Number two, you can do surgery. Number three, you can do chemotherapy or radiation therapy, radioactive therapy, or what we call radioactive therapy. So these are the three main. Some are good, some are not good. Okay, like for example, on medicine, let's start with medicine. So on medication for thyroid conditions, some of them include anti-thyroid medication, and this medication block the ability of your thyroid to make hormones. Okay, like 𝗪𝗶𝗱𝗪. This mostly is used to treat hypothyroidism. It's used to treat hyper, not hypo, sorry. It's used to treat hyper because its main focus is to block production of the ability of your thyroid to make more hormones. So it's used to treat hyper, not hypo. Like 𝗪𝗵𝘁, for example. But we have so many. 𝗪𝗵𝘁 is one of them. We also have beta blockers. Beta blockers like propranolol. Propranolol or beta blockers are used to treat symptoms. These are not direct. They don't directly treat the thyroid problem, but rather they treat the symptoms that are blocked or other conditions that are blocked by your thyroid condition. For example, it's propranolol. Propranolol is used to treat the palpitations, to reduce your heart palpitations. Mostly is used by people with hyperthyroidism. Then we have radioactive iodine. This medication damages thyroid cells and eventually leading to the destruction of your thyroid gland. It is a treatment option for hyperthyroidism and thyroid cancer, but it is not good mostly for hyperthyroidism, because what it does, it will destroy your thyroid gland, which means now you'll develop a condition that is called hypothyroidism. Then we have thyroid hormone medications. For example, is 𝗪𝗶𝗱𝗏, which is used to treat hypothyroidism, because hypothyroidism is when your thyroid is not producing nerve hormones, and therefore you need now medicine to help your thyroid produce this medicine. Secondary is the surgery. We discuss about the medicine part of it, treatment. Now we are at the surgery. Surgery is the most common type of surgery associated with thyroid conditions like hyperthyroidism, and it's called thyroidectomy. So thyroidectomy is the procedure of removing your thyroid gland. A thyroidectomy is a surgical removal of your entire gland. It's one of the treatment for hyperthyroidism and also thyroid cancer. Another surgery option is called lobectomy. Lobectomy, which is to remove part of your thyroid gland. So this is very common and the most suitable when you're treating hyperthyroidism, because hyperthyroidism is when your thyroid is producing more hormones. So you just cut a piece of it, like 90%, 80%, depending on what your doctor will advise, just to make sure that the part that remains is enough to produce the required amount of hormones. It's called lobectomy. Now, the third one is the radiation or chemotherapy. Mostly this is used to treat thyroid cancers. And remember, removing the thyroidectomy is also a good treatment for thyroid cancer before it spreads. So it's always good to remove it. If you have a thyroid cancer, just remove your thyroid, and then do the chemotherapy and the radiotherapy just to clear any cancer cells that could have remained around your thyroid. Now, both therapies will kill cancer cells. Either it's radiotherapy or chemotherapy. They will both kill the cancer cells, and they will prevent them from growing more. So, and in that process, your thyroid gland will also be killed in that process. Now, what are the risk factors for developing a thyroid condition? What are the risk factors for developing a thyroid condition? So, thyroid disease affects anyone at any age. So it is not a disease for women, it is not a disease for men, it is not a disease for old people, it is not a disease for young people. You can get thyroid problem at any age, any gender, any time. So there are so many other things that you would relate or you would connect to these diseases. For example, some factors may put you at a higher risk of developing thyroid conditions. For example, is having a family history of a thyroid disease by a person. So if there is anyone in your family who has a thyroid disease problem, most likely there will be someone else in that family who will develop that disease. So it is hereditary or generic. Let's call it generic. So thyroid disease is actually generic. So if I have thyroid disease today, most likely my kids or my grandchildren will have the same problem. Having an immune condition such as type A diabetes, rheumatoid arthritis, lupus, some of these conditions may end up, if you have these conditions, you may end up developing thyroid problems. Also taking medicine that is high in iodine. If you go to the hospital, you're given medicine that has very high amount of iodine, it may cause your thyroid to have problem. And both being older than 60 years, especially if you're a woman, you're also at a very high risk of getting a thyroid problem. How do you take care of your thyroid? For you to take care of your thyroid, just make sure that you eat food with enough iodine. And some of these foods, example is cheese. Go to the supermarket, buy cheese. Make sure once in a while you eat cheese. Cow's milk, but not much of it, because milk is also not very good. Eggs, yogurt. This food have iodine. Saltwater fish, samaki ya Mombasa has a lot of iodine and very good amount. In fact, that's one of the best food that you can eat to take care of your thyroid. Shellfish, seaweed, soya milk, soya sauce, some of these things you can Google. Go to online, Google foods with the foods that will help you take care of your thyroid. And most important, it is not important, or it is important not to consume too much iodine, because it can cause problems. So as you eat iodine food, make sure you eat the right amount of iodine so that you don't develop other issues as you try to make sure that you have enough iodine in your body. So if you have any question or any concern about your thyroid health, don't be afraid to talk to the nearest doctor, anyone you know, or you can also send an email to us at healthtalkdesk@gmail.com. Go to our YouTube channel, follow our page, comment, send us an email. We are on TikTok, we are on Twitter, we are on Facebook, we are on Instagram. Okay, and you can also talk to us through a foundation that we formed to take care of people with thyroid. It's called TDAK, or TDAK Foundation. If you go to www.tdakfoundation.org, you'll find more details about your thyroid health. Thank you very much for watching, and I hope that this was educative. You've learned something about your thyroid health. You'll teach someone about their thyroid health. Please share this video. Subscribe to our YouTube channel so that we can educate people more about their thyroid problems. Thank you very much for watching. I'm your host, Alan. Until next time, bye-bye.
Join us at Health Talk Desk. Make sure to subscribe, like and share our videos to keep spreading vital thyroid health insights.